Good afternoon and welcome to our webinar today on guidance for the cleaning and disinfection of schools during COVID-19. Thank you for attending. Just as a reminder, all attendees will be in listen-only mode for the duration of the webinar. However, we do welcome your questions. Please type your questions in the question box, and our experts from the Department of Public Health and the Department of Education and the Yale School of Public Health will be here to answer your question. This session is being recorded and it will be posted to the CSDE's COVID-19 webpage. I'd like to turn it over to Charlene Russell Tucker, Deputy Commissioner, Connecticut State Department of Education.
Thank you, Michelle, and welcome all. And first, I hope you're all safe. As we know, we're encountering interesting weather across the state right now. But thank you for joining. This is our second in our series of webinars brought to you with our colleagues from the Department of Public Health and the Yale School of Public Health. And we thank you for joining us. I know Lori is on from the Department of Public Health and she'll introduce the staff there. We also have on the Department of Education side, John Fazzanelli, who is a division director here, as well as Chris Soto, who I know will be mastering and managing all our Q&As at the end of the call. So thank you very much. Appreciate the collaboration. And I'm going to turn this over for a quick hello from Lori, an introduction of the team.
Thank you, Charlene. I'm Lori Matthew, Department of Public Health, Environmental Health and Drinking Water Branch, and I'm here with my subject matter experts. Meg, say hello and introduce yourself.
Hey everybody, I'm Meg Harvey. I work in the environmental health section at the Department of Public Health.
And Tom St. Louis. Tom?
Hi, I'm Tom St. Louis. I work environmental and occupational health assessment at the State Health Department.
And Charlene, that's our team. And thank you again for having us on.
Thank you very much. And Danielle, we'll have you do a quick introduction, make sure that Yale is represented here.
Hi, everybody. I'm Danielle Scavone. I'm the Assistant Biosafety Officer in Environmental Health and Safety. Thanks for having me.
Thank you very much. And with no further ado, I'm going to turn this over to, I think, DPH or maybe Tom, you're going to get started.
Yep, I'll get started.
Thank you.
Great. Thank you, Charlene. Thanks, Lori. And as I said earlier, I'm Tom St. Louis from the State Health Department. Thanks to Meg Harvey, who's one of my colleagues at DPH, for being here, and absolutely thanks to Danielle from Yale for being on this call. We've had a great working relationship through all this with Yale, and Danielle's been great to work with on this. So next slide. For mitigation strategies. So, you know, if you were on the ventilation call last week, you will have seen this already. So sorry for the repeat slide, but you know, really cleaning and disinfection and this enhanced cleaning and disinfection plan we're talking about is really one small strategy in kind of an entire suite of strategies that schools are going to have to employ in order to go back to in-person learning. So, you know, we know that schools already do a lot of cleaning and disinfection. You know, we're going to advise a few enhancements to that, but also improve ventilation. I know a lot of you have been working on that already. You know, physical distancing as much as you can in classrooms, face coverings, cohorting students, and then, of course, you know, being able to identify and isolate any students or staff that have any kind of symptoms of COVID, or certainly those that test positive with COVID. Slide 3. So I just mentioned all those other strategies. You know, the one really good thing about COVID that we weren't sure of in the beginning was that we're seeing that the vast majority of transmission is happening from direct droplet transmission from one person to another. So basically, you know, small pieces of spit coming out of my mouth and going into somebody else's mouth is really the way transmission is happening. So we're not seeing surfaces as a major source of transmission of this virus. And that's very good news. So, you know, unlike something like a norovirus when it goes through a school, right? Anything anyone touches, it's easy for somebody else to touch it and then have it as well. And that's why we see things like norovirus burn through schools so quickly. So we're kind of lucky in that we don't see that as a major source for this virus, but we do know that, you know, cleaning and disinfection, especially enhanced cleaning and disinfection like we're talking about, does reduce the overall viral load in the school. So we're not saying it can't happen that people can get it from surfaces, but, you know, certainly cleaning and disinfection helps with that. These protocols, if you keep them in place, even when COVID-19 is gone, will benefit, you know, during flu season, during, you know, norovirus outbreaks and things like that. And then, you know, showing parents and students and staff that you have a good cleaning plan in place is really going to alleviate some fears that people have about going back. Slide 4. So before schools open, what we're asking is that people perform basically, you know, the once-over cleaning you would do before school started normally. Any areas in the school that have been unoccupied, like a lot of them have been unoccupied all summer, those areas just need routine cleaning and don't really need any disinfection product applied. If you have summer school or other things that are going on and you have some areas that are going to be in use right up until the point where schools return, then you should, you know, refer to your cleaning and disinfection plan for how to handle those different spaces. And so in developing your cleaning and disinfection plan, there's really 4 or 5 things. Later, Meg informs me that later on in our slides, we only have 4 instead of 5 bullets. But for purposes of this slide, these 5 things to concentrate on. First is identifying areas that just need cleaning, and then other areas that need cleaning plus disinfection. So cleaning first and then disinfecting. Most areas of the school will only need cleaning. They won't need routine disinfection. Look at your schedules for cleaning and disinfecting and really consider when to maximize your process in terms of cleaning and disinfecting. Think about ordering now and reordering stuff that looks like it might run out. Not only the chemical products, but also any of the materials you may need, PPE for cleaning staff, or kind of any other materials you may need for doing this cleaning and disinfection. Make sure you have the appropriate level of staffing to execute the plan. So a plan is only as good as the people who are in charge of executing it. And if you don't have enough people in place to do all you're asking them to do, you know, in a timely manner and to do it well, you know, that's going to significantly affect your plan, even if your plan looks perfect on paper. And then that staff and students and staff, teachers need training on what's going to happen and information about the cleaning plan. And then certainly the cleaning staff need to be trained on personal protective equipment, how and when to use it. Slide 5. So like I mentioned in the previous slide, I mentioned some areas needing cleaning and then other areas needing cleaning and then disinfecting. So what I want everyone to remember is that it's not cleaning or disinfecting. That if you're going to have areas where disinfectant is going to be applied, those areas need to be cleaned first, or else the dirt and oils on the surface will negatively affect the operation of the disinfectant. So any area that's getting disinfectant needs to be cleaned first. So the areas needing only routine cleaning, most indoor areas only need routine cleaning, the kind of cleaning you would do on a daily basis. Items that really aren't touched frequently. So floors, walls, windows, carpeting doesn't need to be, routinely steam cleaned or anything like that. Light fixtures, air vents. So this isn't a situation, where the entire school needs to be, drenched in disinfectant every day in order to keep people safe. You really want to focus, and I'll talk about that later, you really want to focus disinfecting in certain parts. And then any outdoor areas, none of those areas need to have disinfectant applied. The sun and outdoor environmental conditions are very effective at killing this virus, which is why we've said all along outdoor activities are better than indoor activities. So you don't need to be spraying disinfectant on, gym structures or anything like that. No railings, benches, whatever. Slide 6. So there are areas that you should focus cleaning first and then disinfecting. So some of those are high touch areas. So these are hard surfaces in the building that are touched by a lot of hands during the day. Doorknobs, obviously, light switches if you don't have, kind of the automatic light switches. Any handrails or stair rails as you're going up and down the stairs. Desks and chairs are things that should be cleaned and disinfected regularly. I know there's a lot of questions about how often to do that, and we'll talk about some strategies, hopefully during the Q&A, about what you might think about doing with desktops. Any shared equipment, although we're really discouraging people from sharing equipment. If there is equipment that needs to be shared, it should be disinfected. And then bathrooms and locker room surfaces. So any kind of countertop or really any surface inside a bathroom or locker room are spaces that should be cleaned and disinfected, hopefully more than one time a day anyway, and we'll talk about schedules in a minute. Any porous materials. I know there was a question that came in advance of the webinar about porous materials. So porous materials should be laundered routinely, right? So if you have towels or oven mitts that get used in cooking class or any kind of jerseys that students wear kind of during a phys ed class or anything like that, those items should be laundered, after each use. If you have porous items where laundering or cleaning is going to be difficult, the recommendation is really to remove those items from use, because it will be difficult if you've got if you have a chair, or a soft couch or something like that. It will be difficult to clean those surfaces routinely. Slide 7. So schedules. So daily, the focus should really be on doing at least a routine cleaning of all the areas that get used in the building. So if you have areas of the building that aren't used every day, they don't need to be cleaned every day. They need to be cleaned after they're used. And then daily, really cleaning followed by disinfection of high-touch areas that are identified in your plan. And a good plan will include kind of all the different areas of the school specifically that you would count as high-touch areas. And then the goal is to do twice daily cleaning, cleaning and disinfection for bathrooms and for handrails going up and down stairs. Particularly if you've got, if you have an almost full in-person situation, there'll be a lot of hands touching those railings. So twice daily would be, at a minimum, would be the goal for those. Same thing with locker rooms, although I think a lot of schools are just not using locker rooms, but certainly if locker rooms would go hand in hand with bathrooms. And then, you know, really, if you have to prioritize certain things, prioritizing high traffic bathrooms, you know, so we all know in all these schools there are some bathrooms that are kind of out of the way and don't get used a lot, and other ones that are high traffic bathrooms. So focusing on those first, and then any stairwell handrails as well, especially in the stairwells that get used frequently. And then just kind of as a side note, you know, if you're going to be doing a cleaning on one day over the weekend, if you can, instead of when everyone leaves school on Friday, if you can put that cleaning off until Saturday afternoon or even Sunday, that's going to allow a significant amount of time for the virus to basically die off on its own. So, you know, for hotels, for example, we're recommending that before hotel rooms are cleaned, that there'd be a 24-hour period where they're empty and just the ventilation's running. So that same kind of thing can be applied here to schools. That if you can, you know, provide kind of a wait time for custodial staff before they do their cleaning, that's going to reduce the viral load even more. And I think Meg's going to start on slide 8 here. Yep.
Yep. Can everybody hear me?
Yep.
You can. Okay, great. I lost my internet and I am on a Wi-Fi hotspot now, so I'm keeping my fingers crossed. The weather is wild. So
Okay. Yeah.
As Tom mentioned, there are multiple steps in the cleaning and disinfection plan, and what we're calling the third step is where you're going to identify and procure your cleaning products. Now, the good news is that the COVID-19 virus is really very easy to kill with routine, ordinary cleaning products that you'd be using in schools. So just your detergent products, your soap products, and water are really highly effective for surface cleaning. So this is why we have been saying that really routine cleaning is all that's needed in most areas of the school. So routine, just ordinary products or commercially prepared cleaning products may be used. But a reminder, the Connecticut school green cleaning law has not gone away. So any cleaning products that you do procure need to meet the Department of Administrative Services environmentally preferred purchasing specifications. And those currently are that cleaning products must meet or must have the green seal or the eco logo certification. And probably most of you are familiar with this, all the information that you need regarding the school green cleaning law and purchasing environmentally preferred products are on the DAS website. Can go to the next slide. So now we're going to talk about identifying and procuring your disinfection products. So again, another reminder, Tom said it a couple times, I'll say it again, that disinfecting is a two-step process. So cleaning first is going to remove the dirt and the grime and a lot of the germs. And then the disinfection step is going to deactivate the germs that are remaining. And really your disinfection products are not going to work as well unless your surfaces are cleaned first. We are recommending the place to go to find disinfection products that are approved for use against the COVID-19 virus is the Environmental Protection Agency's List N. And The EPA has a really nice search tool now on the list where you can search for products using registration number, keywords in the product name. You can also search for contact time, pretty much anything about a product. Beware of fraudulent claims on products, product labeling about COVID-19 effectiveness. EPA has issued an alert because there are a lot of products making fraudulent claims. So always double check whether the product you're interested in purchasing is in fact on EPA's list N. So we're also recommending that where you can, you want to choose the safest, least toxic disinfection products possible. And so if available, and if you can procure them, select products that are less likely to trigger asthma. And so you'd be looking for products with active ingredients such as hydrogen peroxide, citric acid, lactic acid. And then in contrast, products to avoid if you can, or definitely avoid overuse of, are products with ingredients that could cause or trigger asthma. And these would be products with ingredients such as sodium hypochlorite, which is bleach, the quaternary ammonium compounds, which we also call the quats, and peroxyacetic acid. And you can move to the next slide, please. Okay, so most of the products on EPA's list N are for disinfecting only, but there are some products that are listed as cleaners and disinfectants. So be aware that if you choose one of those, you need to use it twice. First as a cleaner, and then following the instructions for use, first as a cleaner, and then as a disinfectant. Other things to pay attention to when selecting products are what is the required contact time on surfaces. Each of the products is going to have a listed time that it needs to remain on a surface in order for it to be fully effective. And there is a lot of variability from product to product. Some products have contact times less than a minute, and others have up to 15 minutes, even 30 minutes of contact time required. Another important thing to look at with a product is it listed as ready to use, or does it need to be diluted? Many products are only for use on hard, non-porous surfaces, but there are some products approved for soft or porous surfaces. So keep a lookout for those specifications on the EPA's list. And you can go to the next slide. Okay, so training and communication, this is sort of the fourth step and the fifth step combined into one, because we're thinking about staffing levels also. And this really shouldn't be last, because it's not intended that this would be an afterthought. This training and communication is really something that you want to think about right from the start. So to sort of focus on communication first, before school buildings open, you really want to communicate all aspects of, actually, this may be, we may have skipped a slide. Can you try to go back one?
Is this the right one, Lori? I mean, Meg?
Yep, that's it. This is let's see. Actually, it's actually slide. Can you try going back one more? I think we still have skipped one.
My numbering is off by one because I added a slide to the beginning. So this is really, yeah. So this is really
It should
13.
say 11 at the bottom.
11, okay. Let me go back.
Yeah, I think you actually might have gone ahead.
I wonder how I did that. Well, you talked about this one with the end product. So do you want me to go to the next one?
Yeah, the one right. It's the one right after this one.
Training and communication, is this correct?
Yeah, hey, there's a delay on my end.
Yes, it takes a second to, and I'm hoping for everyone's sake that my power stays on.
Yes, perfect.
Keeps flickering, yep. So here we go.
That's okay. This is perfect. So this is focusing on communication. So wanting to communicate your new or enhanced cleaning and disinfection plan really to everybody, not just the people who are going to have cleaning duties, but the entire facilities team, your school administrators, your teachers, staff, parents, and students. So they're clear on what you're doing, what your plan is, what you're not doing, and why. And in addition, very important to remind staff and students not to bring their own cleaning and disinfection products from home. Let them know what products will be available for them to use in their classrooms. And there's nothing wrong with providing teachers with their own small spray bottles of the product that the school is going to be using, along with appropriate cloths for them to apply the product. In addition, important to communicate how people should report cleaning issues or problems to facility staff to get them corrected. And then you can move to the next slide. Great. So talking a little bit about training now. So before school buildings open, anyone who's going to have cleaning and disinfection duties need to be trained about a variety of things. They should understand what the planned cleaning and disinfection schedules are before, during, and after the school hours. They should understand how to obtain and use appropriate PPE for the chemicals that are in the products they're going to be using. And PPE there's infection control PPE, personal protective equipment, and there's PPE for the chemicals. And typically for cleaning and disinfection chemicals, this is going to be things like gloves, eye protection, and possibly respiratory protection. Each product is going to have different recommendations for that PPE, and those can be found on the product specific safety data sheet. In addition, staff using products need to know if they have to be diluted, what the dilution instructions are, what the appropriate contact times are, how the product should be applied. If teachers are going to be given their own spray bottles, you're going to need to walk them through how they should be applying the cleaning and disinfectant product encouraging them to, or teaching them how not to put a lot of the product into the air, spraying on a cloth and wiping, things like that. And then what to do if there is a spill of a product or there is an adverse health reaction to a cleaning and disinfection product by anybody doing the cleaning or by a building occupant. And you can move to the next slide. And a couple of the other reminders regarding training. Again, we went one more ahead. That's the next one. Yes, great. So reminding them again that disinfection is a two-step process. All surfaces need to be manually cleaned first before disinfection is applied. That the disinfected surfaces need to be air dry per their contact time. Fans shouldn't be used to shorten the drying time. Disinfectant shouldn't be just wiped off. It needs to stay on the surface for the appropriate contact time. Any type of ventilation that you're operating, even if it's opening windows, should be running during cleaning and disinfecting, and this is just going to help reduce any exposures to the chemicals in the products. And lastly, any staff with asthma or underlying respiratory problems need to receive the safety data sheets for the products they're going to be using and talk to their physician for any specific medical information before they use a commercial cleaning or disinfectant product. And then the next slide, you could advance, and that's what Tom is going to pick up with talking about fogging, specifically fogging of disinfectant products.
Thanks, Meg. Is that slide up now? I can't see it. I'm sorry.
Yes, it is.
Okay. So we've gotten a lot of questions about our fogging circular letter we put out, back in early June, when we saw that schools were getting a hard sales pitch for a lot of these fogging and spraying of disinfectant services and equipment. We tried to jump on that right away to let people know this is not encouraged. And the reasons why it's not encouraged are, a lot of the things you heard in the rest of the webinar today. Disinfectant products are not benign products. A lot of them can be asthma triggers. Overuse of disinfectants pose a risk to the staff, to occupants of the building, and certainly the staff that are doing it. There really isn't any time savings to doing this, to doing any kind of spraying or fogging of disinfectant. Every surface needs to be manually cleaned anyway. Those surfaces that need to be disinfected can usually be cleaned, then have the disinfectant sprayed on it and walked away. So there really isn't any time savings. There's certainly significant costs associated with a lot of these. Certainly, I'm sure if some of you have priced out some services from cleaning contractors, you'll see that these are, a lot of times very costly. And again, most areas and surfaces in the school don't need regular disinfection, like we talked about earlier in the webinar. It's risky and it's unnecessary to bathe your school in disinfectant product routinely. And so, it's going to provide no additional protection and or no long-lasting protection, despite what a lot of sales pitches involve. Kind of spray this on, and for 90 days, you don't have to worry about disinfection. With those things, if it sounds too good to be true, it probably is. So So that was kind of behind why we wanted to get out ahead of this early and really warn people against fogging of disinfectants in their schools. And then the last slide, we can move to slide 15 now. Just reminding people that enhanced cleaning and disinfection is really just one part of this entire suite of mitigation strategies that schools are going to be using. Face coverings are going to be, one of the most, if not the most important mitigation strategy, but there's a lot of other ones that schools are going to use as well. And really, cleaning and disinfection strategies are only going to be effective if all those other mitigation strategies are being followed. There's not enough cleaning or disinfection that you could do in the school to counteract nobody wearing face coverings or just kind of, congregating together or whatever. So all of these strategies are important. Cleaning and disinfection certainly is one of them. And then the last slide, just want to thank everyone for, being on the webinar today and for everything that you do. Custodians are the often unseen people in the school that keep the school running. So just thank you to all of you for all that you do to keep the school, all our schools, clicking along and healthy environments for our kids to learn in. So with that, we will open up to questions.
Great, thank you, Tom. Danielle, did you want to add anything before we go to questions?
Yeah, actually, if I could, it's music to my ears hearing those trigger words like contact time. As a biosafety professional, it's very important for people to understand that there's a proper way to clean and disinfect. So it's very important, and it's great that we were hearing those concepts over and over. As far as the products that the people are selecting and using, I work at Yale, so I'm not bound by your green list of chemicals for schools. But regardless, sometimes you've got to do a little bit of homework when you look for products on list N. Just because you might put in a product name and it doesn't pop up on that list, that doesn't necessarily mean it's not found there. The EPA does a very good job of providing some guidance as far as like little tutorials and information on how to actually search list N. So I encourage people to look into that so that they know exactly how to find their products that may or may not be on that list. In biosafety, we usually talk about the 3 C's of disinfection, but I'm actually going to add a couple more because we've been adding a few more of the letter C's. So we talk about cleaning. Right? You've got to clean before you properly disinfect. You actually have to have the proper chemical and select the proper chemical for your use. You've got to use that chemical at the proper concentration, right? You've got to use the proper contact time. Otherwise, that chemical is not going to be doing its job. So that's another very important C for people to find. Coverage we have added, because you'll see if people are wiping or if people are using a spray bottle to apply a disinfectant, well, for every droplet that you see that's hitting the surface, there's a lot of spots that are missed. So we like to have, in our world, we like to have a glistening surface so that you want to make sure that you are covering the entire surface with that disinfectant. It doesn't mean you're drenching it or you're drowning it. We want to make sure that you've got proper coverage. And another very important point that was raised here is the compatibility of the chemicals that you have. You want to ensure that your staff who may be doing things that they haven't had to do or have to encounter all the time, training wise, we want to ensure that they are using things that are compatible, right? They made a very good point about don't let your kids bring their own materials into the classroom, because what if that chemical, what if that disinfectant that they're bringing in has a chemical reaction to something that was used in the classroom? So the compatibility issue of disinfectants is very important. I mean, bleach and ammonia, right? That's not a great scenario for anybody who's having to mix or having to use chemicals. So be very mindful of that and mindful of providing that proper training to your custodians and understanding or having them understand The chemicals that are provided were selected for a reason, and they should be following the safety directives on that. And one last point that I wanted to make, as far as anything on the list N or using the material according to specification, those things were tested, right? If there's a contact time of 10 minutes, then you've got to be using it if it's ready to use, or if it's a dilutable material. You've got to be really, really mindful of that. Unfortunately, we've seen that some people have diluted down some of their chemicals, some of their ready-to-use disinfectants in order to try to save money, which is a novel concept, but when you're diluting, you're really minimizing or contradicting the effectiveness of the material that you have selected in the first place. So it's very important for you to use things as they were intended to be used. That's my little spiel.
Thank you. Well,
Thanks,
we're gonna jump
Danielle.
right
Sorry, I had
Tom.
intended to kick it over to you, so luckily Chris
No,
is
it's all
here
good.
to cover me. Go ahead, Chris. Sorry.
Oh, okay. No, thank you. We're going to jump to questions. I think we can get through all of these questions in the time that we have. But first, to answer some quick ones. So this presentation will be posted. I saw some questions in the box about people having trouble with their internet. So this will be posted along with the transcript. So just stay tuned. Once we have a link, that will be communicated out via the State Department of Education. There was also a question about the ventilation presentation, and that one should be up shortly as well. And we can also provide the PowerPoint with that as well. So going into the questions, you know, Tom, you talked about the cleaning on Saturdays, and you know, one thing that we're hearing from a lot of districts around their reopening plan, especially ones that are thinking about a hybrid model, is essentially using a day during the week to use for cleaning. And so can you explain essentially how that day can be used effectively if districts are thinking about using a day during the week to do some cleaning?
Yeah, I mean, so, you know, if you were, we hear a lot about kind of, doing deep cleaning, or we're, you know, people are closing down offices to do deep cleaning. And really, we try to avoid using that word because, you know, routine cleaning should be, you know, the appropriate level of cleaning. It shouldn't be kind of like, you know, we just wave a wand over it most times and then we actually clean it on another day. So, you know, to the point where you can use an entire day to, you know, really give the school the once over and really pay attention to certain areas that may have gotten less attention. And you can also use those times for staff to get together and meet and discuss kind of how the plan's going, any issues they're having with the plan, and kind of ways to fix those issues. So, I mean, obviously you can do it in kind of a, you know, you'll have a little more free movement around the school to do cleaning if nobody's in the school that day. So that'll be helpful. But also you'll probably have some extra time that day. So using that time to really talk about and retrain kind of people on the cleaning plan really helps.
So I think that also answered a question that Courtney had about defining deep cleaning. So kind of dispelling this myth that there needs to be something above and beyond what a routine cleaning should be, and then maybe doing the once over on some of those high touch areas.
Yeah, and you know, like we said, you know, we're lucky. This virus is very easy to kill with regular products. So doing routine cleaning, you know, making sure you have a plan to hit all the areas you need to hit, but doing routine cleaning will be very effective at getting rid of this virus.
So Phil had a question about the green products. I think we answered that through the presentation, both through DAS's list and also the EPA's list. There was a question about supplies that are shared by a cohort of students and whether those need to be disinfected daily. And again, I think it's important to say cleaned and disinfected, because that was a distinction that has been made in this presentation.
Yeah, and I think, you know, certainly if you have if you have students who have to share materials in the span of a class period, I mean, you should avoid that as much as possible, if that's at all possible. But to the extent that needs to happen, you know, wiping those things down in between use is certainly helpful. But if you have things that are used kind of on a daily basis and then put back into a, you know, common area or something, then yeah, cleaning and disinfecting those products would need to be done daily.
Great. And so we did talk, there was some previous questions around foggers. I think we touched on that topic pretty well. Peter had a question about the reasonable expectations for frequency of desk cleaning and sanitizing. I think you did cover that in the presentation.
Yeah, I mean, yeah, we talked about it a little. You know, it's going to be a tough strategy because obviously you're not going to have custodial staff to go around and clean every desk surface in between every class. But also the likelihood of a student picking up the virus from another student who used a desktop, again, it's very remote. You know, if we're in a low community background spread of virus, and you know everyone is wearing masks and people are washing their hands frequently, kids are, I'm sure, you know, going to put on hand sanitizer all the time. Then you know, doing it, you know, and again, if you can provide even you know, the teachers with a small squirt bottle and they can go around and spray the desks, you know, in between, again, just to do cleaning. They don't need to be disinfected in between each class period, but if they can be wiped down with a cleaning product, that's going to be pretty effective in killing the small amount of virus that might be on the surface of that desk. And then as the custodial staff does the cleaning, you know, after school is out, they're going to end up disinfecting those areas.
So there was a question that also came in about, you know, to your last point, or not the last point, but you know, you've kind of said this, that you know, the main transmission source is, you know, person to person for the virus, and it's not necessarily living as much. Is there a statement that we can share about the contamination of services not being the main route? Is that somewhere on either DPH's website, or is it just basically something that we're saying here that people can take back to their constituents or their you know, stakeholder groups?
Yeah, I mean, they can certainly take that back. I'm sure there are multiple places in documents where we've said that. I know I said that in kind of many of the guidance documents I wrote. So, you know, that's a frequent statement out of the health department. It's a frequent statement out of CDC. So basically any of these guidance documents you find are going to include some form of statement that says, you know, surfaces aren't really a significant source of contamination or infection.
Yeah. This is Megan. I would echo that. Those statements definitely appear in the DPH guidance document, and they also definitely appear on the CDC website.
And Meg, which guidance document are you referring to?
The DPH guidance for cleaning and disinfecting schools,
Okay,
that
great,
is
great.
included in the state document as an additional resource.
Yes. Okay, great. Yeah. So that's in our, and that is linked in our Advance, Adapt, Achieve document as well for those that are on the call.
Correct. Yep.
There was a question about any special considerations regarding school kitchens. Does anybody want to address that?
Yeah, I actually researched that a little bit today because I saw that question came in. Kitchens should really be considered separate from the rest of the school because there are FDA food code requirements for disinfection, cleaning, and sanitation, which is different than disinfecting. So you certainly wouldn't want to be introducing, like Danielle said, these compatible chemicals. You wouldn't want to be introducing chemicals into those kitchen prep areas that aren't normally used. And there's going to be the qualified food service operator in the school who's going to know all the cleaning, disinfecting, and sanitizing procedures for the kitchen. So I would say, treat those kitchens kind of separate from the rest of the plan.
There was a question about bathroom surfaces because those are high traffic areas. And so should those be cleaned at the end of the day, or is there a more frequent cleaning schedule that should be, if possible, used for those?
Yeah, so bathrooms we're asking people to target at least twice daily for bathrooms. So that would be, either before school and then midday, or midday and then after school, at least twice daily, because not only are those high traffic areas, but they're areas where people may take a mask off. They're areas where people are using the restroom, and we know that people who have this virus, when they're using the bathroom, they can have an enhanced amount of virus kind of being excreted. So that's why bathrooms are potentially more infectious areas, but they're also, like you said, high traffic areas. So twice daily or more on bathrooms.
There was also a question about the use of hand sanitizers and non-alcoholic versus alcohol-based. So can you comment on the difference between those and recommendations?
Yeah, Danielle, you want to comment on that?
Yeah, sure. Anything that we would recommend at Yale, again, it's Yale, so I can't really speak to your schools, but we're looking at a 62 to 71% ethanol base in these products. Some of them you're also going to find, this is more of an FDA realm, where they've put out statements and they've put out lists of hand sanitizers that aren't exactly containing proper ingredients that really should be used in that means. Just a word of caution though about hand sanitizers. It's all well and good, and we, if you don't have access to a sink and to proper hand washing, hand sanitizers are great. But people should be reminded that that does not exclude the need for proper hand washing. We've seen a lot of hand sanitizers in bathrooms, which is kind of pointless. You've got running water and soap. So it's kind of, sometimes we take a little bit of a step back, and we just want to remind people that proper hand washing, and kind of teaching your kids or teaching your staff that, if you're washing your hands properly, 20 to 30 seconds, singing happy birthday to yourself a couple times, properly washing your hands, and then turning off the water with a paper towel, then that actually is something that we would encourage as well. Not all schools will have paper towels. I'm not quite sure. Well, you all have paper towels, obviously, but the automatic dispensers, and we can kind of go into different designs of bathrooms. But as far as hand sanitizers, I think it's important to keep in mind what the FDA would end up saying with the proper ingredients.
Thanks, Danielle. A question came in around self-contained rooms, specifically like special education rooms or pre-K rooms. This seems very, similar to, basically a cohort. But since they did ask specifically around special ed rooms and pre-K rooms, self-contained, any thoughts on that? And if there are any special considerations that are needed for cleaning on those?
Does self-contained mean that people are in there all day and nobody comes in or out?
Yeah. What I would gather from this question is that it's probably the same group.
Yeah. So, I mean, again, the amount of virus people are going to pick up from surfaces is really nothing in comparison to the amount they're going to spread to each other just by being in close contact, potentially. So, there isn't really a need for enhanced cleaning, or even I would say probably interim cleaning. If a room is going to have a cohort of kids for the entire day, the surfaces in that room are going to be kind of the least available place that they're going to get any virus from. So cleaning them daily like you do for the rest of the school. If there are desktops in there, obviously cleaning and disinfecting those desktops or anything that might have been touched. But other than that, nothing more enhanced than that.
Okay. So Anne had a question about what school nurses' responsibility are for training custodians. I don't necessarily think that it's the nurse's responsibility to train custodians on cleaning, but I'm curious to see if you guys have any other thoughts on that.
Yeah, no, I mean, if they're, yeah, go ahead, man.
Sorry, Tom, I was just thinking
No, go
that.
ahead. I think, yeah.
Sorry, I can't see you. I would think that type of a supervisory or training role should be done by more of a custodial supervisory staff, as opposed to a school nurse. Again, I'm not that familiar with your rules of engagement in the school system, but I think it's appropriate to match the trainer with the trainee.
Yeah, that's exactly what I would say as well. It should be a supervisory staff person, or if you don't have that person, there's a lot of training contractors that can help with that as well.
So we are approaching time, but I think we can get through some of these questions unless people really have to jump off from our panelists. You think we can go another 5 minutes? Is that okay?
Sure. Yep.
Okay. So one quick question is, should we shut down water stations?
So our recommendation has been that to the extent they can be used as bottle fillers, you can leave those operating. I know some have the built-in bottle fillers already, and there's a way to bypass the direct drinking function. Really the problem is going to be direct drinking out of the fountain. So there are also some change out nozzles you can get for the ones that have a drinking function that kind of go up and curl around and can be used as a bottle filler. So if it doesn't have a bottle filler attached, some of those heads can be changed out to become bottle fillers. But we really do want to discourage people from having fountains operating in a direct drinking function.
So after your slide with regarding the electrostatic sprayers, there were still questions about that, whether or not they're recommended or not. So I just want to make sure we emphasize the point whether or not they're recommended, because basically it seems like there are districts that have already invested in them, they're using them. And so can you just reiterate what the slide said?
Yeah, so we are hearing some of that. We tried to put this out as early as we could, but I know some people invested early in the fogging or electrostatic spraying. We are strongly discouraging it. Not only because it's costly, and people say, well, we already have it. We don't think people should be spraying disinfectants around the school using a spraying mechanism, whether it's electrostatically charged or not. Some people have said, well, the chemicals we use are not, dangerous chemicals or whatever it is. But, we think it's best that, if you want to do disinfection and you want to do it right, you have to do manual cleaning. You should use a disinfectant product. And if you're using a disinfectant product, you should not be pouring that into a sprayer or fogger, electrostatic or not, and spraying it around the school.
Great. Any special considerations for school buses?
So, again, a school bus, just like a classroom, is going to be a situation where the other people on the bus are more of a risk than any of the surfaces on the bus. So, you know, to the extent that buses can be cleaned and disinfected between runs, you know, that's great. If they can only be cleaned between runs to allow the, you know, because the proper contact time can't be achieved, that's probably going to be fine too. There are only certain areas of a bus that would be considered high touch areas. So the tops of the seats and maybe the pan of the seat themselves. Most other things are not high touch areas. So, you know, and again, a bus over the weekend, if it sits in the bus yard over the weekend, is having a lot of time to disinfect itself just because of the sunlight coming in and the fact that it's sitting, you know, in open air for that amount of time.
Thank you. So this was, I thought this was a good question. So the new guidance talks about how preschoolers are not required to wear masks. And so does this mean essentially that there could be more virus in that room? And if so, is that going to require more cleaning throughout the day?
Yeah, again, you know, this is a situation where it wouldn't impact cleaning during the day. The impact would be on the fact that they're in the room with other kids without a mask. There's going to be a lot of strategies in place to try to exclude people from the school who have symptoms or have COVID. You know, there are a lot of studies that show that kids are not very effective at spreading the virus, certainly not as effective as older kids who can be just as effective as adults. So, you know, they breathe less, they have less forceful breathing, all that kind of stuff. So, you know, there are going to be different strategies used in different places. Masks aren't really, you know, going to be a great strategy for pre-K kids. But, you know, in terms of needing to clean and disinfect areas more often, you know, it's probably not going to be necessary, you know, other than it would be treated as just like any other classroom in the school.
So Charlene, I see you jumped on. Does this mean it's time?
I jump on really thanking our colleagues. I know some of the people have been having problems staying on because of power outages and all that. So thank you for all doing such a phenomenal job and such great information. I know this will be posted, and for those who are still on with us, just know that you have access to our wonderful experts here. Even we've just set up this starting this morning, 8 to 9 o'clock. Every Tuesday morning until when we don't need to. There is a call scheduled for superintendents to also have their staff available with them, school medical advisors, school nurses, to be in a call that we can continue these conversations, and specifically health-related questions that will be answered. We started that this morning. So just know, I know this will be posted. It's such awesome information. I'm over here learning myself about things that we need to do. So really great information, and we'll make sure this is available. But just know, for questions that you still have, there'll be opportunities to continue to have these conversations and to get your answers directly from our experts. So I really just want to thank our colleagues here, Tom and Meg and Danielle, for the wonderful partnerships to continue to support you. We're in this together, and I just really wanted to say that. Thanks, Chris.
All right, well, thank you, everyone. And again, if you have further questions, feel free to contact us. We'll download the questions and get any unanswered stuff out. Thank you all.
Thank you.
And be safe.
Bye, everybody.
Thank you.
Thank you.
Bye.